So starting off, we have our thyroid cartilage seen here in purple. This is a tough, flexible tissue that forms the front part of the larynx, and it supports and protects the vocal folds. Next, we have the hyoid bone seen here in pink at the top. This is a horseshoe-shaped bone, and it's the only floating bone in the body. It sits superior to the laryngeal cartilages, and it supports your tongues and plays a key role in speaking and swallowing. Next, we have the cricoid cartilage seen here in green. This is a ring-shaped cartilage. It is thin in the anterior and it is broad and tall in the posterior aspect, as you can see. Next, we have the arytenoid cartilages seen here in red. These sit on the posterior aspect of the cricoid cartilage and glide forward and back to change tension in the vocal folds, so shortens them and returns them to resting position. Next, we have the epiglottis, which is seen here in orange. This is a leaf-shaped cartilage, which is thin at the bottom, and then it widens and broadens at the top. The epiglottis is moved down and backwards to cover the larynx, to close it during swallowing to protect it. Then we have the corniculate cartilages. These are the yellow triangle-shaped cartilages you can see there. These are paired cartilages and sit at the apex or top of the arytenoid cartilages to support them. Next, we have the posterior cricoarytenoid muscle here, seen in this teal color. When this muscle contracts, it will cause the arytenoid cartilages to rock away from midline and may slide it upward and backwards, which results in an increased space between the vocal folds, causing vocal fold abduction or opening. And this is innervated by the recurrent laryngeal nerve. Then here in yellow on either side, we have the lateral cricoarytenoid muscles. And when these contract, it will cause the arytenoid cartilages to pull towards each other or towards midline, and that results in vocal fold adduction or closure. And the LCA is innervated by the recurrent laryngeal nerve as well. Then we have our two interarytenoid muscles. So we have the transverse arytenoid, which is seen here in blue. And when this contracts, it will cause the arytenoid cartilages to pull towards each other or towards midline, which results in vocal fold adduction. And then when the oblique arytenoid muscles contract, seen here crisscross in white, it will cause the arytenoid cartilages to pull towards each other in a tipping action, also resulting in vocal fold adduction. So these two work together to create vocal fold adduction. And the interarytenoids are also innervated by the recurrent laryngeal nerve. Next, we have our two thyroarytenoid muscles, which are shown as these red and blue toothpicks. So together, these two, the thyrovocalis seen in red and the thyromuscularis seen in blue, form the bulk of the vocal folds. When the thyrovocalis, again the red most medial toothpick, muscle contracts, it will reduce the distance between the thyroid here and the arytenoid cartilages to shorten the vocal folds and make them thicker and or increase their internal tension, and that results in a lower pitch. And then when the thyromuscularis muscle contracts, seen in blue, it will cause the ventricular folds to move closer together, and that results in increased tension in the false vocal folds and the lower pitch. So overall, together, when these thyroarytenoid muscles contract, it will cause the vocal folds to shorten and thicken, resulting in a decrease in pitch. And these are also innervated by the recurrent laryngeal nerve. And then next, we have the cricothyroid muscle, seen here in orange. And when this contracts, it will cause the thyroid cartilage to be pulled forward and downward towards the cricoid cartilage in order to lengthen the true vocal folds, resulting in an increase in pitch. And this muscle is actually innervated by the external branch of the superior laryngeal nerve. And then lastly, we have the trachea, seen as these black rings here. This is your windpipe. It begins immediately below the cricoid cartilage, and it is made up of C-shaped cartilages, and they are incomplete posteriorly, as you can see here, because the posterior wall of the trachea is a shared wall with the esophagus.